We were live now. Mm. Hello, everyone. Thank you for tuning in. Thank you for joining us today on Mount Moriah Radio and Mount Moriah Television. We are live. We are live. We are live. We're live. And before I go on to introduce my very special guest today, I just want to say that this is Juliet Hammond. You're listening to, and this is Juliet Hammond's show. And the topic we have tonight is prostate cancer. It's a discussion, and we will welcome any question. We will welcome people to ask their questions, or if they need a clarity about things, also to let us know. So, who is my guest today? He's a wonderful person, a friend, a mentor. I have known him for years. This gentleman is Professor Grotimi Jayesimi, an innovative and award-winning consultant in obstetrics and gynecology. He is based in the Mid and Southeast of South Essex University Hospitals. Professor Joyce graduated from Ibadan Medical School, and ever since then, he has been helping medical research and innovation. He's a mentor to many, a father to many, an encourager, and also he is someone that when he starts something, he finishes it. Professor Rotimi Jayesimi, you're welcome to Juliet Hammond Show. God
Yeah,
bless
good
you.
evening, and thank you for the kind invitation. It's a pleasure to be with you this evening.
It's
And
always
to
an honor
the
to have you.
listeners, good evening as well.
Good evening to you. Please tell us. I know I have said a little bit about you, but I know you have this, long CV. Just let us know what you do.
I think basically I'm in health. I'm interested in health matters, but I started off with female health, being a consultant in obstetrics and gynecology. That's what I've done for most of my career. But as a man and as a family man, I'm also interested in health matters as it affects men, as it affects children, as it affects the wider community, and not just in my local hospital or in my locality, but globally. So at times I do describe myself as a global health uh, expert because that's one of the things I am passionate about, building health systems. But currently, I also look after patients in terms of making sure patients do not come to harm in the hospital in which I work in my role as Associate Medical Director for Patient Safety. So that's in a nutshell. So, first of all, do no harm. And then when you look at the global health, it's prevention is better than cure.
Absolutely. And I have seen you speak and do programs all over the world. So we're so honored to have you in our show today. Honestly, we are. We're talking about prostate cancer. Prostate cancer. What is prostate cancer to start with?
Yes, I'll start off by first of all, what people do want to know is what is the prostate gland? So where does it start from, or how do you get prostate cancer? Women will never get prostate cancer because they don't have a prostate gland. So it's a disease that men do have, and that's because they have a prostate gland. And the prostate gland is a very small gland beneath the bladder, the neck of the bladder. And that's where the seminal fluid, the fluid that mixes with the sperm, that makes the sperm viable to be able to fertilize an egg, that's where the fluid comes from. And that's where the gland is. And what happens? How do they get cancer? First and foremost, we don't know what causes prostate cancer. But what we know is that it is very common after the age of 70. That's in the wider population. At some point in life, if men live longer, they will get prostate cancer. And it could be just slow growing, causing no problems. But the ones that we worry about is the one that are fast growing, they are aggressive and can result in death. Now, so cancer is a rapidly growing cells. Cells that are normal suddenly become abnormal and then they start growing rapidly, destroying the gland. And if nothing is done, then it can spread to other parts of the body. With prostate cancer, it tends to spread to the bones, first and foremost.
Mm.
And one of the things I would say, like in women, we do have a screening for cervical cancer, cancer of the neck of the womb.
Yes,
So
yes.
can we screen for prostate cancer? In the United Kingdom, there's no screening program. There's no national screening program for prostate cancer. Uh, but what I would tell people is this: what are the symptoms that one can get before getting prostate cancer or
Mm.
before it's early stage prostate cancer? So that's
And
where,
sorry, Professor, I just wanted to ask. I know we don't have the screenings at the moment, but can it be detected early? How can it be detected early without the screening?
yes, well, with a blood test. Now, usually from the age of 50, if you go to your family doctor, your GP, and ask for the PSA blood test, then they can
PSA.
use that. Yeah, PSA. Now, one of the things that we're now discovering is that black men tend to get it earlier. And when they do get it, it's even more aggressive. So we're trying to advocate that black men should have it maybe from the age of 40 or from the age of 45. I would say at least the age of 45. Ask your doctor perhaps for a yearly PSA blood test. It's unlikely that they will refuse you.
Hmm. So, when you say that, people are now getting it early, how early now? How early are people now getting this, prostate cancers?
Yes, one of the things we should remember is that it doesn't become nasty or very aggressive or obvious at
Mm.
the very early stages. But that's why I said 45. But normally, when you look at the literature, people will tell you, oh, it's usually from the age of 70 and above, 70 to about 79. That's when men get prostate cancer. But that's in the wider community.
Mm.
And so, even for Caucasians, my advice would be from the age of 45 to 50, you can always ask your GP for a PSA blood test. It's a simple test and it's not expensive. And what happens is there is a range of what is considered to be a normal PSA level.
Mm.
Now, when it's high, it does not mean that one has got prostate cancer because even simple things like infection of the prostate gland, if you're a horse rider or if you ride bicycle, if you're sexually active, if you do the blood test, the PSA is likely to be high. So the very first test you do, if it's a high level, it does not mean you've got prostate cancer. What they have to do is repeat the blood test maybe in 3 months' time. And again, it depends on how high it is. If it's very, very high, that's a different story. That's when your doctor will examine you in
Mm-hmm.
his clinic, do an internal examination in the back passage. And what the doctor is looking for when they do a rectal examination, they put the finger, slightly uncomfortable, not painful, is to feel what the gland feels like. Normally, it should be smooth, it shouldn't be enlarged. But when you're feeling something that's craggy, hard, irregular, then you may start thinking perhaps there's something the matter with the prostate. And then that's where you refer to the urologist. That's the specialist who look after prostate glands.
Mm. So, what are the symptoms? What kind of symptoms would the person be experiencing if they are either in the early stage or advanced stage of prostate cancer?
Well, I do hope we don't get to the advanced stage, because by the
I
time
do
we
hope
get,
so.
yeah,
Yes.
I think today is to try and make sure that we don't get to that stage.
Mm.
And the symptoms that we do get are usually not specific. I mean, for example, if you are peeing a lot, or if there's blood in your urine, or the stream, how the urine is flowing, is not free, or you feel you haven't emptied your bladder completely. These are
Yes.
symptoms that one can get, but it's not specific for prostate cancer. It can happen even in simple enlargement of the prostate gland. But what we say is that awareness, when you have the symptoms, you go to your doctor. If they think it's a water infection, they check you out. If they think it might be more than that, you have the internal examination, and depending on what they find, then they will know how what the next steps of management will be. So just to summarize, going to pass water a lot, waking up at night to pass water, a,
Hmm.
a poor stream, uh, and when you talk of advanced cancer, maybe things like backache, bone pain. If you're having that, then it might be that you have prostate cancer, you didn't know you've got it, and it's beginning to spread to other parts of the body.
Wow. I hope it doesn't get to that stage. So, we were talking about screening earlier. What are the risks? What are the dangers of not being screened early?
Well, I mean, the like I said, there's no screening test,
There's no
but
screening at the moment.
there's no screening test at the moment. But I think we as a community, and when I say community, citizens of this country, should continue to talk, engage with government as to why we don't have a national screening test.
Mm,
1 in 6 men will get prostate cancer. Prostate cancer is the commonest cause of death in men when it comes to cancer. The second one is lung cancer. So if
mm,
it's the commonest cause of death, then why don't we have a national screening test for prostate cancer? I'm sure
mm,
eventually it will come, but like
mhm.
most things, you need advocates or
Yeah,
advocacy campaigns to get the government to look into it. So
yeah.
I can foresee it coming. Research is taking place in various universities as to what can be done for early detection of prostate cancer.
Mm.
So watch this
Because
space.
because we the women, we do have mammograms,
Yeah,
screening for breast cancers, and we have other, cervical cancer screenings as well, like that.
that
So we're just wondering, if we women have that, why can't men have a simple test
yeah,
for prostate cancers as well? So
that's
it's something that they have to look into quite urgently as well, because it's really affecting a lot of men. What are the risk factors? Is it genetically?
there is some genetic basis to it. If, for example, one's father or a brother or an uncle has prostate cancer, then one
Mm,
is at increased risk. I don't. It's not quantifiable, but the risk is higher if there's a family history of prostate cancer. So it's
mm,
genetic. Now we as human beings have a gene that controls the way the cells in the body grow, the
mhm.
BRCA1 and the BRCA2 genes. Now,
Yes.
at times, these genes become faulty, they undergo mutation. And when you have these faulty genes, especially BRCA2 gene, then you may be at risk of uh, prostate cancer. Even BRCA1 mutation can also put one at risk of prostate cancer. So
Mm,
basically, yes, it is genetic. There's some genetic basis to it. But other risk factors include obesity. It's been shown that obesity could be a risk factor, like I said, family history. And there are studies that have also shown that the pesticides that farmers use,
Right.
can also result in increased risk of prostate cancer. So one has got to be careful when using pesticides in your garden or on your farm, because there's the potential that that might be a risk factor. And again, being a man,
Mm,
without saying, is a risk factor. One of the things the pathologists tell us is this: if people live to a long age, into your 80s, and maybe die of old age or die of a heart attack or a stroke, when they carry out post mortem, they do find that most men do have prostate cancer. And you may say, but why hasn't it presented? That's because
mm,
it's slow growing and not causing any problem. That's the slow growing type. But you can also have the aggressive variant. And
mm,
why I am stressing people of color is that we tend to have it early. It tends
mhm.
to be more aggressive in
Right.
our community. And that's why, again, I am clamoring for people having the PSA blood test done early.
So if you're married, tell your husband. If you've got a brother out there, a friend, male friends, you need to let them know that they have this test and have this test early. Simple blood test. Go to your GP and having it tested, right?
That's correct, yes.
Yeah, a simple blood test. Should men be worried about their health generally? I know there's some men, they go to the gym all the time, they try to keep fit and all of that. But do you think that men should be worried about their health generally? Because some people don't even care.
My answer is unequivocal. Yes, men must be worried about their health. Perhaps we shouldn't say worried. Men should be aware of their health.
Mm,
Uh, if, for example, we can perform MOT on our cars
mm,
every year to make sure it is road worthy,
mm,
and if there's something going wrong, you change it or repair it, or you check your engine oil. If we can do that to our cars, then why can't we do that to our body? So awareness is important. You must know your body. And what I usually say is this: if there's any deviation from what is normal, and you say, well, this hasn't happened to me, this pain hasn't, I have this pain is going on for more than a week, or I have this cough is going on for more than 2 weeks, then you must see your GP. With
mm,
prostate cancer, like I said, if you're passing water too often, there's blood in the urine, then you must knock on the door of your general practitioner, and then they will do what is necessary.
mm. Does pain play a part as well? If you have pain,
Pain, I don't.
or
It's not
pain,
it's not an early symptom that you'll get. If you
it's
have
not.
pain when you're passing water, that might signify uh, uh, a water infection, and you'll get tested for that. If you have pain around that area, it might be an infection of the prostate gland, and again, that will be checked out by your doctor. That's a prostatitis, which is different from prostate cancer. That is important. If you go to your
Mm,
doctor complaining of pain, you will have a rectal examination. And people might say, what is a rectal examination? The doctor puts just the little finger in the back passage and feels around the prostate gland. One, to see whether it's enlarged, to see what they contour, whether it's smooth, it's supposed to be smooth, and then they can advise you accordingly.
mm, mm. What are the treatments out there? Because obviously, there must be the way of treating it.
Yeah, well, before we treat it, we will need to make a diagnosis. And usually, what happens is if, for example, you've had a number of PSA blood tests done and it shows a rising level and it gets to a level that's above normality, then your doctor, the urologist, bladder specialist, will ask you to have an ultrasound examination of the prostate gland. And while doing that, they can also take a biopsy of the gland. More so, if an ultrasound examination, they see areas that look suspicious. They take different biopsies, send that to the laboratory, and then the pathologists look at that under the microscope. And that's how we make a diagnosis of a prostate gland. Now, I mean, prostate cancer.
Cancer. Yeah.
Now, yeah. You said what are the treatments available?
Yeah. What are the treatments available?
Yeah. Now, in the current climate where the human has autonomy over their body, you can choose to do nothing, even if you're told you've got cancer. You can say, "Well, I'm 79. I've lived a good life. I don't want anything done." So we shouldn't forget that doing nothing is an option open to the patient, even if it's prostate cancer. But apart from that, again, we have tablets or injections. I don't want to mention brand names, but these are drugs that you give
Hmm.
that slow down the growth of their gonadotrophin antagonist. They reduce the growth of the cancer. So if you're an elderly person, don't forget again that one can be old, 79,
Yeah.
and you're frail and you may not be fit for surgery, or you may not even want surgery at that time of your life. So, at that, you can be offered drugs, either tablets or the injection forms. And this can also slow down the growth of the cancer. Then there's the surgical option. Years ago, and in some centers, what they do is what they call the open prostatectomy, where the surgeons take out the prostate gland. But with advancement in science now, you've got robotic surgery, where it's done with you have keyhole, it's almost like keyhole surgery, and you go home the next day after your operation. So that's surgical intervention. You also have radiotherapy. If it's still early stage and confined to the prostate gland, there's what we call brachytherapy, in which, how do I describe them? Maybe like rice pellets that contain radioactive material are put into the prostate glands, and the radiation emitting from the pellets destroy the cancer cells over time. So that's another option.
Yeah.
And increasingly now, we're now having what we call high intensity focused ultrasound. You use that to destroy the cancer cells. It's done under ultrasound, and you use high intensity waves or beams to destroy the cancer cells.
Mm.
And more recently, and it's not fully in practice, is what they call the nanoknife therapy.
Yeah.
Again, that is more conservative, more targeted to the cancer cells, rather than taking away the whole prostate gland away. It
Mm.
targets just where the cells are. So
Mm.
that those are the surgical and therapy available to patients. One of the things I would tell people,
Yeah, exactly. What can people do, to
yeah,
also prevent that from happening?
yeah, I think the earlier one diagnoses it, the
Yeah.
better the outcome. Uh, the difference between success rate are similar between whether it's robotic surgery or whether it's radiotherapy. But one of the things that people worry about is the potential side effects. Um, if the cancer cells are very close to nerves in that area, then
Mm,
one can suffer from erectile dysfunction after surgery, or even after brachytherapy, one can suffer from erectile dysfunction. And that is one of the things that worry men, that, oh, you mean that after the surgery, I will not be able to perform sexually? Yes, that's a possibility, but there are treatments available for that. Things that men can be given, even right from the day you have your surgery, they give you tablets to try and make sure the blood supply to that area it's kept going. And there are various methods of addressing erectile dysfunction. Now, one has got to weigh the risk of dying from
mm,
cancer
yeah.
against the pleasure that you get from sexual intimacy. So some men will tell you, look, my family is complete. I've had a good life. Well, I'd rather not die from prostate cancer. We all know cancer is not a good thing. I
Mm,
will manage the erectile dysfunction. So we shouldn't let that scare us off from seeing a doctor or undergoing any treatment. But the thing is, the doctor will tell you the benefits, the risk of the treatment, and it's up to the individual to decide whether they want surgery, whether they want radiotherapy, whether they don't even want anything. So it's a choice thing.
mm, mm. It is a choice thing, but they have to be wise as well, and
That is.
also make sure that they're checking these things early as well. So, how often should they be checking themselves?
I would say usually in terms of the blood test, a yearly blood test.
Yeah, blood test.
It's not expensive, and I think your GP will, as said, will accept to do it. It's different if it's a costly blood test, then that's where the difficulty will be. And again, there's no proven study to tell us how often to do it. Some people will do it every 6 months, some people will do it every year. So between 6 to 12 months is what I will recommend. And I
Mm,
gave this rider that I'm a gynecologist, I'm not a urologist, but I'm a man and I have read about this, so I do know at least something about it. So
about
the advice I'm giving to you today is to raise awareness of the condition. But the ultimate thing is if you are worried, if you do have symptoms, you
it.
must see your family doctor, your general practitioner.
How do we raise awareness within our communities? Can we
Well,
explain these things more openly?
yes, I must commend Mount Moriah Radio and Television, because what you're doing tonight is raising awareness in the community. And again, as a community, we shouldn't hide things. When you feel unwell, when you're worried about some symptoms, share it with somebody. If you don't want to share it with somebody, then talk to your GP. What we do find out in some communities is that people prefer to
Mm,
bury their head in the sand.
yeah, to
So
dance.
when things are going wrong, oh, you're not looking well. Oh, you're not feeling well. Oh, you're going to the toilet too often. Oh, they just say, no, I'm okay. There's nothing wrong with me. Whereas there's something wrong with them. So I think talking to a trusted family member, talking to your spouse, talking to a trusted friend, talking to your GP is important. And again, like I said, in all things you get wisdom. When you find out that I've never had blood in my urine, but I'm beginning to notice blood in my urine. I don't wake up at night to pass water, but
Mm,
now I'm waking up 2 to 4 times. Then you
mm,
must think there must be something starting to go wrong. And that's when you seek help from
mm.
your GP.
So, seek help early and try and check these things as often as possible by doing blood tests. and also be openly, be open about it, speak about it, talk to people about it. It's not a taboo, and also be mindful of your health. I think men should really be taking their health also seriously, just like women we do. And then we should be looking at the screening. It shouldn't come too late for the men, really. If there are people that we have to be talking to, maybe our GP, whenever we go visit the GP, we say to the GP, we need screening for prostate cancers for men, just like the women have um, breast cancer screening and cervical cancer, screening. Men should also have that. So speak to your consultant, to your GP, whoever, your family practitioner, and also creating that awareness.
And also speak to your MP.
NP, that's
Yeah,
it,
yeah,
because
because they are the ones who will lobby that why don't we have this? And if we give them evidence as to why it should happen, they're the ones who will now take it to the parliament. They have their committees, the committees look at it, present it on the floor of the parliament, and then you may find out that from there things fall in place and eventually becomes acceptable. But I can see it coming at some point in time.
that's it. We hope, because it affects the black people more
Yeah,
than other
more than
race
Caucasians and more than Asians.
Asians as well. Well, we're looking forward to seeing screening for men for prostate cancer soon. And what is your last thought, Professor? I'm always very happy to have you in my show. Honestly, you're such a joy to have. What is your last thought? What do you
My
have to say to us?
my last thought is you've got to look after number one. You've got to look after yourself. Prevention
Mm,
is better than cure. Early diagnosis gives you a higher chance of cure. So we have to be aware of our own individual bodies. And when there is any deviation from normality, then we should seek advice. One of the things I will say is cancer is not a curse. It's
mm,
not somebody in who doesn't like you, somebody who has looked at you one way, talking spiritually or culturally now. It isn't a curse. We don't know why it happens, but the thing is, if it happens, there's treatment for it and there's cure for it, and there is hope. So let us live in hope.
yeah.
Thank you.
It's not the end of the world.
It's not the end
This
of the world.
this whole Bible. That's wonderful. Thank you so much, Professor Timothy. I'm always glad to have you, like I
It's a
said
pleasure.
before,
It's
and
a
thank you
pleasure.
so much for this enlightenment. I'm sure many people will play these videos, they're gonna listen to it over and over, and also we're going to be playing it on Mount Morale Television. Thank you so much for listening,
You're
and
welcome.
we hope to see you again for another interesting topic. You know,
Yeah, thank you.
for
Thank you
another
for having
interesting
me.
topic.
Thank
You
you
have
for
a
having me.
no problem,
Lovely.
no problem.
Thank
Thank you
you.
so much, viewers. Thank you, viewers, for
Lovely.
listening
Thank you.
and for also watching us tonight. We hope to see you again for our next program. Have a wonderful Easter, everyone, and a wonderful break. Thank you. Bye bye.
Bye
Hmm.
bye and good night.
Yeah, good night.